Men, you urinate frequently at night and it interrupts your sleep. 1, you stand like a police officer waiting for urine to start flowing. 2, your bladder holds back the remaining urine and you still feel the urge to go back and urinate, right? 3, in the bedroom, your chief is weak and struggling to perform, leaving madam unhappy. 4, make we no talk am. And yet, you're still comfortable thinking it will go away on its own, right? Oga, your prostate is ticking. The day it enlarges completely, your chief down there may face the knife of a doctor. And you will spend a lot of money trying to fix it. It's a lot. Now that you have come across this video and you're hearing this, it's not a mistake.
I want us to... This person have not just used Born Slim, but she have used it for loads of people. Like when she tell you the things she have used Born Slim to give people that have and they took it and they were fine, you'll be like, are you sure? I'm going to be, and the good thing is that she's a medical doctor. Now you won't say, does she know what she's saying? She's a medical doctor that have studied both Nigeria and abroad, and she's going to be here now to tell us what those products have done for she. In fact, she has testimony about almost all the product, but I was pinpointing because I know she have lots of testimony about Born Slim. So let's have Dr. Sylvia Emmanuel. Dr. Sylvia Emmanuel, if you're here, please, the floor is yours. Let's hear your testimony and just help us and be brief. Let's see if you can have 1 or 2 persons randomly in the house to share their testimony. Thank you. Are you in the house, Dr. Sylvia?
I am here, so excited, so excited. Thank you very much, my queen mother. I'm so excited. Good morning, everyone. I am so excited to have to give this testimony. When queen mother reached out and told me that I have to give this testimony, I was so excited. I had a lot of things doing. I had the surgery. I had to hurry. I said, God, help me because people need to hear. People need to hear. My mom used to give another day. She said that what does it mean? It means that it is a sin for you to know something and not to say it because you don't know who is hearing it. You don't know whose life you are saving. So I don't want to waste much time. I just want to dive in right to it. But before I go forward to give that testimony, I want to tell us something. Every single drug, hear me clearly. Hear me clearly. If possible, hold your ear. Note this down. Every single medication you take, something as simple as vitamin C and paracetamol has side effects. They are nephrotoxic and hepatotoxic. They are toxic to the kidneys and toxic to the liver because these are the washing machines of the body. People do not know. That is why these days you see little children, younger people having kidney diseases, liver diseases. You are asking yourself, what is happening? Note it. Paracetamol, vitamin C, every single drug has side effects. But these supplements do not have side effects. So I came to the conclusion that since these drugs have side effects and these supplements do not have side effects, what then? Can't I just use this for people and see what it does? And it has not disappointed me. I just want to narrow my testimony on this particular person. I want to narrow it because I am using these supplements to take care of people. So if I start giving testimonies on all the products, of course, we will not live here. Except Mastermind wants to create an avenue where that will happen, but not here. So let me concentrate on this particular one. You see this thing that is in all the packages and people don't value it, they throw it away because when the value of a thing is not known, of course, abuse is inevitable. You see this thing? Do not throw it away again. Just tell me where you are. Let me come and pack it because I'm actually lacking it right now. Well, it all started last year, December, when I joined this program. I joined this project, and I want to say to people out there, joining this project, it should not be all about money. What about people you can help? What about yourself? What about your health?
Mhm.
So I know that money is good. I'm getting the money. Glory be to God. Because the money I'm even getting outside is bigger than the one I'm getting in my DTC. But what gives me the joy is for someone to call me and say, Dr. Sylvia, thank you. It started last year, December, the very first Alahaji that I helped. When I just came back and I was in a place, working in a place, and an Alahaji came. He didn't come for the prostrate. I don't know whether anybody knows what is called prostrate. Prostrate is one of the highest killers of men. Prostrate swelling, let me bring it down to how you will understand it. Because in a man's body, as a man is getting older, everything depreciates, but the prostrate, it enlarges. It is okay as long as it doesn't cause problem, but it can enlarge to a particular point where the man starts having problem with urination and a lot of things. That's what we call benign prostate hypertrophy, highest killer. So the man has already gotten to a level of prostate of 16.35. This is something that should be 0 to 4. 0 to 4 as normal. So he has already scheduled a surgery in Egypt. And so he also had hypertension and diabetes and is on treatment for that. And as at then, I didn't know that he had problem with, what do we call it, a weak erection. Because what the doctors will not tell you is that hypertensive drugs at the long run causes men to have weak erection. You will no longer have good erection. Even for men, for women also, libido reduction. But they won't tell you. So he came to take his drugs. He wanted me to prescribe more drugs for him. He was going to be away for like 2 to 3 months or thereabouts. So he wanted to take his hypertensive and diabetic drug along with him for this surgery. I said, what surgery is that? And he told me prostate. I didn't know when I blotted out. I said, Alhaji, don't do it. The reason I was telling him not to do it because let me tell you something that a lot of people will not tell you. 90% of every woman that have gone through prostate did not live to. They didn't live long. They might not tell you, and then he's operated on and he died. I was like, Alhaji, do not do it. He was like, he can barely urinate. They're using a catheter to remove the urine and all that he has to do. And I told him, son, I said, what if I told you that I have something that will be able to take care? I said, when are you traveling? He said he's traveling in the next 3 weeks to 1 month. That is when the surgery is scheduled, and he will be leaving Nigeria to Egypt for that. I was like, okay, fine. Alhaji, you know what's going to happen? From now till that time, why don't you give me time to try and see if I can take care of this? He was saying, well, I don't have anything to lose. And so what did I do? I had Coledus and this bone slim, this thing that you patrol away. Yes, listen. I had it. And so I picked bone slim and Coledus. I knew that Coledus would do the job. Let me just tell you. Because it wasn't even supposed to, it was supposed to be Coledus and Restore Life. And that's okay. Bone slim and Coledus. I gave it to him. Now, what happened is nothing short but miracle. I didn't know that Alhaji had a weak erection, but let me tell you something. 3 days later, Alhaji came shamelessly screaming from the reception that after 11 years of weak erection, Alhaji woke up with what men call morning wood. He had an erection. He came with his wife for that testimony. He came. And that Coledus and that bone slim I gave Alhaji, I did not ask Alhaji to pay or to join. I knew that these products were affected because I took it myself. And so I knew he was going to come back, but I didn't know that it was that soon. So Alhaji came back and told me that he had an erection. It was marvelous. And there and then Alhaji signed out with 190 and collected the drugs. As at when Alhaji started this product, the prostate was 16.35. For those who are medical personnel or those who, of course, people are educated, so go and research. And so Alhaji took those products for 2 weeks plus and came back, and then we did the prostate, what we call prostate specific antigen. We did it. And then it reduced from 16 point to 8 point. After another 1 month, because when Alhaji came and it has reduced, he started urinating, we removed the catheter, he now canceled the strip. And as I'm talking to you now, Alhaji alone has brought over 20 people with this same prostrate conditions. And this same Born Slim and Koledus has taken care of it, and more people are coming. And Alhaji, irrespective of the fact that it was prostrate we were treating him for, today, as I'm talking to you, he's no longer on diabetic or hypertensive drugs. He is totally okay. He no longer, and another thing, while Alhaji was taking this hypertensive and diabetic drug, it was disturbing his kidney. So when he did his urea and creatinine and liver function test, we were struggling between high and let it come to normal. But after 2 months of the medication, that is Born Slim and Coledus, quote me right, Born Slim and Coledus, nothing else up till today. The last time, the after 1 month, when we were doing the prostate specific antigen, we decided to also do the urea and creatinine and the liver function test. And guess what? All those liver enzymes that were skyrocketing from the drugs he'd been taking for more than 15 years of antihypertensive medications came down. As I'm talking to you today, Alhaji is one of my strongest anchors. In fact, if Alhaji wants to take anything, if I haven't said Alhaji, go ahead, Alhaji will not take it. That is how he has trusted me. And I've told him, I said, Alhaji is not me, trust God. He said, you saved me from traveling. And when I even told him how much he can sign in, said the lowest is 69,990. But if he goes for 3 packs, instead of 210, is 190. Alhaji said, just that amount of money? He never believed it. It was too cheap compared to the surgery he was to do. So what am I saying? I am saying that, you see, Born Slim, I am saying it again, quote me. And then apart from that prostate, Born Slim have a lot of other conditions that you can take care of. Malaria, for instance. Surprising, right? Surprising. You are surprised, right? Malaria. Yes. Malaria. This. Just take 2 morning, 2 evening. And that is for malaria. That's what I use it for. Arthritis. Spondylosis. What Mama Hadiza said she had. Lumbar spondylosis. Surprising, right? So keep throwing it away. Born Slim takes care of that. Very surprising. All right, what about ladies who are talking about belly tummy? Let me tell you something that this Born Slim will do for you. If you want to lose belly fat, you can lose belly fat without losing the whole other body, because there are people who are slim but they have big tummy. This Born Slim also helped me. I wanted to tuck my tummy in, and this Born Slim, I still maintained my structure because I liked it. I didn't want to lose other fat, and so this Born Slim is very specific. What does it do? Burns extra. Oh my God.
Wow. It's like, doctor, you're going to create another day for us for this, because my phone is buzzing. People have lots of testimony, loads and loads of testimony, but I think Dr. Sylvia is going to be the last person we're going to take. Someone is saying I should go on. It's already 12 o'clock. And we can't take more. Dr. Sylvia Network have thrown her out, but I think that is the last we can take. I see how people are scheduled to testify, and my phone is filled up with people telling me this one did, my choco, lots of product. People are telling me what this product are doing for them. Are you not seeing that our products are amazing? Now you can hear the one Dr. Sylvia is telling us, Born Slim. I knew Born Slim was effective when, just out of curiosity, I went to research about Born Slim. I researched about what Born Slim contains. Okay, someone is saying my wife has testimony. We can't take more again. I still have someone that wanted to share, but Kai, we don't have time again. We don't have time again. Let me see if Dr. Sylvia is still here. So people are asking some question. What is the dosage for Prostrate? Let's see if she can tell them. Okay, network have not allowed her in. But if she don't get it, I'll get the dosage and I'm going to tell us maybe next week during our power cell meeting, because we've already exceeded our time already. Now, out of curiosity, I went and recite the content of Bone Slim and why is it so effective. The content has some, antioxidants in it, different things inside them. And I decided to recommend them. They said it can also take care of, if you're diabetic, Bone Slim is good for you. Okay, you're back. Okay, good. So just tell us, people have small question, please. We don't have time again. It is 12 because some persons have events by 12. Some persons have event by 12, so we can discharge and let them start their events. All right, so Dr. Sylvia, if you're in, just summarize fast in 1 minute so we can. Dr. Sylvia, are you in? Yes, I've already made you co-host, please. Or did I co-host? Yes, you're co-host already, Dr. Sylvia. Dr. Sylvia, please, let's hear you. Go ahead, please. Just summarize in 1 minute, please.
All right, ma'am. Sorry, my video in this particular device cannot come up. Well, just like I was about to talk about diabetes, of course, cholesterol and diabetes and Bone Slim is what I use
Slim
for
and diabetes, yeah.
Yeah,
I researched and I gave that to somebody.
I use cholesterol also and Bone Slim for diabetes. I also use this particular Bone Slim and C247 or complete for hypertension because of the reduction in cholesterol, which is what majorly causes hypertension. Okay, so somebody is asking for the dosage. The thing is that in this combination, a lot of people misuse it. But if you take it accordingly the way it's supposed to take and take it the number of days you're supposed to take, you're going to be okay. The thing is that people do not know that the dosage of these particular medications, the first week is not the dosage, the second week, third week, and fourth week. And people do not know that these particular supplements had to be taken for at least 7 weeks for 8 weeks, which is 2 months.
Exactly.
You must take it. You don't take it anyhow. If you take it anyhow, then you will be one of the people say it's not working. It will work for you in like flooding your system with antioxidant, but it might not be able to take care of that thing appropriately, or it will take a longer time. But if you want to take it like just like Queen Mother has said, the dosage can be flashed. I can make a copy of the dosage and then send to her, which can be sent, of course, to people so that you will know how to prescribe this accordingly, because the dosage first week is not the dosage second week. It shouldn't be the dosage the third week, fourth week, fifth week, sixth, seventh week, and possibly on the 8th week, which is 2 months. And then you can now have a maintenance dose of once a day just to maintain your system, which is what I've been using since I started using this product. And I want to say that this is the only product I've been using on my own since I started. And also for these people. So Queen Mother was afraid that someone shouldn't have stopped their antihypertensive. Queen Mother, don't be afraid. Because once the person's system is stabilized and the person is on maintenance dose of the supplement that the person, there's one thing about the supplement, the one that you are on, please remain on it. It's just like someone who is taking anti-diabetic, you're taking lisinopril, and tomorrow you go to nifedipine. No. Maintain the one that your body has accepted and you will live a very healthy life. That is why people like Barrister Hadiza is healthy, because she has been on her particular supplement. Be on your supplement on maintenance dose after your condition has been stabilized. Don't throw it away. Don't say, I'm no longer hypertensive, I won't maintain my body. No. After the condition is taken care of, after like 2 months, and then you have to be on maintenance dose if possible for life, because you have to maintain your body. Thank you very much, Queen Mother, for the opportunity to speak. And I want to say thank you very much. Thank you, C247 Mastermind, and everybody that is involved and saving life. Thank you very much, and may God continue to strengthen you. Thank you, ma'am.
Okay. Now, are you still doubting this product? Are you still doubting this product? Someone have talked about Ultra H2 little. I had another person I was supposed to talk fully on Ultra H2. I had some videos I wanted to share, but time will not permit us again. Mastermind, I'm going to call up on Mastermind. Maybe you'll give us another day for us to share more, because lots of testimonies. In fact, my phone has been buzzing. People have been chatting me. This one, this one, this one, this one. And that is it. So we're going to circulate the links, YouTube links of this training. Go back, digest it again. Now, just like what we're saying, now this product, just like what Dr. Sylvia said, they are supplements. You can use them for curative. M Global stated them. If you want to, we're also going to post the M Global approved prescription for this product. And in their approved prescription, they say, the doctor, if you also mentioned them last week, that there are dosage you should take for what, when you want it for curative, and there are some dosage for what, maintenance. So after taking for curative and you're fine, what do? Take for maintenance and continue taking them. Just like what we said earlier, those products are just like you're consuming your food the way you should take your food. They are made from fruits, vegetables, but the only thing is that they are made in a way we don't eat our food. I love taking fruits. Now, how do you take your fruits? These ones are not the regular fruits. We'll get watermelon, and you just take the succulent parts and you throw away. Their own is whole fruits. Get watermelon, the back, the seed, the succulent part, they blend all of them. Get orange, including the seed. Some of us, if we buy the seed of orange, for the whole of that day, you won't be able to test anything. But this one, you have all the nutrients together in a capsule using a technology called nanotechnology. Now, this is wonderful. So I want to appreciate each and every one of you for being here today. I'm going to be inviting the mastermind. If you give us another opportunity, maybe before Christmas, we do another testimony, because we have people waiting. Even the people I scheduled, we didn't finish them. I wanted us to touch different products, and we could not get testimony of Ultra H2 fully, even though Dr. Adiza told us about her mom, but I wanted someone that used it here, and it worked well, but we don't have time again. So maybe Mastermind will give us the opportunity to do that next time. So right now, I want you to welcome the person that gave us the platform to do what we're doing today, the Mastermind, the person that allowed God to use him to carry C2 and FG. This man, a medical doctor as well. Are you not seeing? We have doctors. So for him to approve this simply means all these things are things that are working. A doctor, a father, not just a father, a good son, and plenty things. It's all in one person. So let's go to the comment section and welcome our own daddy, our papa, our mastermind, our granddaddy, as it comes up to round up the meeting. Boss, we are here for you. Good afternoon, sir.
Oh, wow. Wow. How many of you are excited? You're excited with everything. You are so excited. Can I see you wave your hand? Can't you see how I look? Can't you see how I look? Yeah. Yes, this is exactly what we do. Yes, you are excited. What you heard now, I'm sure it has really empowered you to know what you have in your hand so that you don't play with it. Thank you very so much. Thank you, Ambassador Juliet. You did noble. I have always known it that any day we are talking about the benefit of this product, there will never be a time that will be enough for it. And I'm going to give you people a tip how this is designed so that you know what we're doing. Now, listen carefully. From my medical perspective, by the grace of God, I've practiced as a medical doctor for 12 years. I've seen everything, a lot of things. I've gone everything. I left. Some of the people that spoke are still currently practicing. Guys are like Dr. Silva is speaking from the hospital, her own hospital that she opened. You know what? Some people are researchers, telling you all this. That's to tell you, we are not joking here. We are not joking here. But I'm going to give you a tip of the product so that you know that what you have entered is not for a moment. What you have started with us is for life. Listen, If you are thinking, let me do these things small and leave, then you want to cut off your life. Let me explain it. Follow me carefully. This is how the body mechanism operates. This product we're taking have high level of antioxidants. And this antioxidant is what fights against free radicals. Follow me carefully. And the way the body mechanism is designed is this. Antioxidant of a newborn baby, a child, is produced endogenous. What do I mean by endogenous? The body of a young child has a tendency to produce this antioxidant its own without taking anything, which means a child will have a better immune system to fight what? Free radical than an adult. But there is something that happened. The reason WHO says, the World Health Organization says you should be taking over 5 fruits and 5 vegetables daily is because they want you to live healthy. And they specify the time from 25 years to 28 years old. You should start what? Taking 5 fruits and 5 vegetables. That's what WHO says. The reason for this is this. As you are growing up in age, your level of your body system producing antioxidant is reducing. So as you are going up, it's reducing. As you are growing higher, it's reducing, which means when you get to 25 years, by then the body is no longer producing it. So which means at this level, I need this antioxidant from external environment. That is it. The way God designed it is this. God designed it that man should live in the Garden of Eden and live forever. But man was